Okay, dear friends, this is Dr. Ezi, and we are still discussing the acute pancreatitis, and it's critical care critical care MRCS Part B OSCE station. Okay, and as usual, we are showing all the questions that we'll show and all the answers needed by the examiner. Okay, so in the last session we finished the scoring systems, and now we are coming to the investigations. He is going to ask you some questions about some parameters in acute pancreatitis. Okay, he is going to ask you first what is the cause of hypocalcemia. Why do you have low calcium in most of the cases in acute pancreatitis? And your answer will be number one. The first cause is fat saponification. Okay, and as you know that there are free fatty acids that combine with the calcium in saponification, and this reduces the calcium. This is one reason. Okay, another reason, some people may develop acute renal failure, and this will lead to low calcium. Okay, another cause or third cause could be the affection of the parathyroid gland, and accordingly the parathyroid hormone may be reduced during this attack, and this may lead to low calcium. Okay, so they are the possible things that may reduce the calcium, and this is your answer in the exam. Okay, well, what is the next question that we'll show in the investigations? He is going to ask you about what is the cause of hypoglycemia. I think that this is easy. Okay, the first answer is that there is destruction of the beta cells, and this will lead to reduced insulin secretion, and this will lead to DM. It may be temporary, it may be permanent, but it will lead to high sugar. Well, this is the one reason. There is another reason, and it is the stress response itself. Okay, so the stress response in acute pancreatitis is a severe disease, and stress response will release the stress hormones, and these hormones will lead to increase in gluconeogenesis and glucogenolysis. Okay, glycogenolysis. I'm sorry, glycogenolysis. Anyway, all of these will release glucose. So the common cause is the destruction of the beta cells, and the stress response also is another reason. Okay, I hope that this is clear enough. Okay, about the investigations also, he is going to ask you here now. Okay, which enzymes are you going to test? And you are going to test two enzymes. The first one is amylase, and this is the old one actually, because some schools and some hospitals are not doing that now. They are testing lipase. Okay, and both of them actually go high, but the problem is that this the amylase is not accurate. Why? He is going to ask you first question, is amylase is found important in scoring systems, and it is not important in scoring systems. You will find it in scoring systems. Okay, not in scoring systems. This is the first thing. Okay, so why you cannot depend on amylase? Why not amylase in acute pancreatitis? And the reason is that if you do if you check amylase so early at the attack, you will find it normal or low, and if you do it after too late or after 48 hours, you will find it also normal or low. So it is not a good indicator for acute pancreatitis. So if you want to do something, you can do lipase, but do amylase, and there will be no problem. Okay. So now they are going to ask you about the radiological investigations. And as usual, for liver, biliary system, and pancreas, you are always going, number one investigation is ultrasound. First thing to do in these cases, ultrasound. Okay. After that, you are going to do CT scan in the case of pancreas here. And what are you going to find in pancreas? As usual, you can see necrosis, you can see fat stranding, you can see abscess, pseudocyst, phlegmon, anything you can see there. But the first is ultrasound, second is CT scan. These are the most common radiological studies. Another one can be added, but not in this question. He will come to it later, and this is ERCP later. Okay, if the cause of this problem is a gallstone. Okay, so but this is not our topic now. Just keep on remembering this CT and ultrasound and CT. Okay. Well, he asked you before a question that is why the patient may be tachypnic in the beginning, and we told that the patient may be tachypnea or increased respiratory rate. Okay, we told you, just to remind you here. Okay, patient may have an abdominal pain. I will answer this question again here. Number two, there may be, pain, sympathetic system, and these things. This is not a reason. Okay, there may be pressure, due to pressure, and pressure will do splinting of the diaphragm, and this will lead to tachypnea also. Okay, and patient may be, maybe he is developing acute respiratory distress syndrome as a complication of acute pancreatitis. I answered this question before. I'm answering it again because it may show again in between the questions. Okay. In the next session, we are going to discuss the management of pancreatitis.